Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. The Invos monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on the utility of Invos system. What are the advantages of NIRS oximetry? To help answer this question is Dr. Ronald Bronicki, Professor of Pediatrics at Baylor College of Medicine, Section of Critical Care Medicine and Cardiology at Texas Children's Hospital.
The standard approach to assessing cardiovascular function and tissue oxygenation has significant limitations. Estimations of hemodynamic parameters such as peripheral resistance and cardiac output, based on the interpretation of standard hemodynamic parameters and perfusion examination, are often discordant from measured values. Advanced hemodynamic monitoring is often necessary to provide a timely and accurate assessment of cardiovascular function. NIRS oximetry provides a unique ability to assess objectively, continuously, and non-invasively global and regional tissue oxygenation. Estimations of hemodynamic parameters based on the perfusion examination, a subjective assessment of pulses and capillary refill time, do not correlate with measured hemodynamic parameters such as peripheral resistance and cardiac output. In this study of pediatric patients undergoing elective cardiac catheterization, there was no correlation between measured cardiac output and capillary refill time. Most concerning, many patients with a normal capillary refill time had a low measured cardiac output, and many patients with a prolonged capillary refill time had an adequate, if not normal, cardiac output. Other studies have demonstrated similar findings. In this study of pediatric intensive care patients, there was no correlation between thermal dilution-derived cardiac output and estimations of cardiac output based on the standard approach of assessing and estimating cardiovascular function. Most notably, many patients thought to have adequate, if not normal, cardiac output had low measured cardiac output, and also worth noting, many patients thought to have low cardiac output had a measured cardiac output that was adequate, if not normal. Additional monitoring modalities such as NIRS oximetry enables the clinician to make a more accurate determination of the adequacy of cardiac output, oxygen delivery, and tissue oxygenation. Global indicators of oxygen delivery such as cardiac output, SpO2 monitoring, and serum lactate levels may not reflect local or regional perturbations in tissue oxygenation. NIRS oximetry uniquely enables the clinician to assess regional tissue oxygenation. Examples where global indicators of oxygen delivery do not necessarily reflect regional disturbances in tissue oxygenation include patients with hypoxic ischemic encephalopathy and a loss of cerebral pressure autoregulation and in low cardiac output states. When cardiac output is limited, blood flow is redistributed from less vital organs such as the kidneys and gut to main perfusion of the most vital organs such as the brain, heart, and respiratory pump. Thus, monitoring tissue oxygenation of vulnerable organs such as the kidneys may provide an earlier indication of a falling cardiac output and oxygen delivery. The assessment of regional tissue oxygenation is unique to the practice and application of NIRS oximetry. This cartoon illustrates the application of cerebral, renal, sometimes referred to as somatic, and abdominal or mesenteric oximetry probes. Advanced monitoring such as NIRS oximetry also enables the clinician to assess the severity of illness and in doing so, to intervene proactively, to establish the underlying pathophysiology, and to objectively assess the response to interventions, and in doing so, to make a timely and accurate assessment of the clinical trajectory. There are several unique advantages to NIRS oximetry over other monitoring modalities. In addition to the regional assessment of tissue oxygenation, NIRS oximetry is non-invasive, avoiding the infectious and thrombotic complications of indwelling vascular lines. It provides a continuous assessment of tissue oxygenation, and the technology is portable, enabling the technology to be readily deployed in virtually any clinical setting.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.